Thank you everybody for your time. My name is Brandon Cagle. Sorry for the delay here. Trying to make sure we have everything available. Been a long day. But we'll say as we know, I'm sorry, scavenging. All right, basically what we wanted to talk about today was the impacts of racism on public health, and talk about how it affects our system in more ways than one, and things that we go through with racism. Like I said, my name is Brandon Cagle with the Lowercase Leaders, and I'm going to pass it over to Abdullah so we could talk about the impacts that racism has on us.
Yes, thank you, Brandon. I appreciate it. I appreciate everybody joining us tonight as well too. All things considered, one of the I think last night in the discussion that we had was looking at year-round civic responsibility. There was many things that came out as far as possible things we can think about, but one of them that came out was staying informed, right? You know what I'm saying? Countering disinformation, countering misinformation, remaining a level of courageousness, remaining engaged, meaning showing up, right? All those things is actually represented in this space right here, right? Again, it's not the only space. We always also try to reiterate that, right? We're not the only ones doing this work. We're not the only ones stepping out and making times in our evening to engage and to be present and support one another. But we are doing it, and we are available to those who access us as a network. So tonight, as Brandon mentioned, we're going to have a conversation about racism as a public health or systemic racism as a public health crisis. And of course, you can't really have that conversation without giving some type of backdrop. We're not going to spend too much energy on the backdrop because we know many of us in this space are aware of it. We're preaching to the choir, but it's necessary to always calibrate. After I share a little bit, we're going to step over to our other guest, which is going to be Salim Abdul Rakib. We also know him as Herman Brown, locally amongst us. And he's going to focus in on one very specific aspect that we know in this modern times that we live in the United States of America, right? A certain type of action of the system, a behavior of the system that has a wide breadth of impact upon us. It's mass incarceration. And he's going to hone in on mass incarceration and focus a little bit of energy on his personal life as well as actual fatherhood. And then we're going to kind of like then take it from the inside, pull it back out, and expand it a little bit further to give us a bigger picture. And then we're going to open up the floor, you know what I'm saying, for us to be able to have a dialogue and discuss, what is the solution over this problem. That is a problem that's not going away anytime soon. Like this is the one that's been here. Actually, you could say it's in the roots, it's in the heart of the soil of this country, but it's not a problem that we intimidated by. It's not a problem we should be intimidated by. It's not a problem we should be overwhelmed by, right? It's a problem that we should be squared up, you know what I'm saying, eye to eye, right? You know what I'm saying, paying attention to, you know what I'm saying, and navigating, because at the end of the day, our children got to inherit this world. So if you have no other reason, right, know that our children and our nieces and our nephews, right, whatever we're dealing with, they're going to have to deal with, and maybe even worse, if we're not squared up and addressing the matter head on. So we'll begin with pretty much just being very clear. We know that there was a series of events, and it happens periodically in the United States of America, where uprisings take place, where people get, always give the example, at least I used to give the example some years back about, kittens or cats, right? Very, predominantly, docile creatures, loving creatures, comforting creatures, right? But a cat, no matter how loving and docile a cat is, if you keep like trying to engage a cat and you put a cat right in a corner and it has nowhere to go, right? And to the point to where you keep pressing upon it, like that cat is something in that cat's gut that's going to rise up, and from his hairs to his nails to his eyes to his voice, right? It's going to actually pounce, right? And it's going to get itself or do what it can to get itself out that corner. So we've seen here in the country that situations get so challenging that from time to time we have these uprisings that take place where people become so discontent and so dissatisfied and they feel so hopeless that they begin to think that the only thing they can do is just express and yell and break. You know what I'm saying? They begin to destroy things, even things that belong to them. Well, that was present inside the George Floyd uprising that took place 2019, 2020, right? We had many ones before, right? We had the Freddie Grays. We had the, I remember, forget some of their names. I shouldn't be getting it. What is it? Brown was his first name.
Freddie Brown.
Huh?
Is it Freddie
Oh,
Brown?
okay.
Freddie Gray,
Wasn't Freddie Brown. No, it
Michael
was Freddie
Brown,
Gray,
Michael
Michael
Brown
Brown.
with
Michael
Ferguson.
Brown,
Brown.
right? Rodney King, right? Then you had the summers of the 1960s and 1970s, right? So we had moments where people uprose. We had the Wilmington 10, right? Uprising, poof, just not going to accept it no more, right? That comes from frustration. That comes from feeling that what other option do I have? You're giving me no other option, right? So in any case, that happened. And around the same time that happened, you had COVID take place. And everybody began to realize that, even though when the data showed us, right, that there's populations of people that's historically, right, disadvantaged, and the disparities between them having access to what they need to have a healthy life and what they need to have a long life, right? What they need to have a healthy life and what they need to have a long life, that they're not getting those basic things made available to them, provided to them. And because of that, right, we begin to see that the crisis of health for those populations, right, are something that require, I'm saying, a significant amount of concern. But the data had been there, right? But because when COVID happened, everyone, right, became at risk. The people that was least most capable of being supported and helped was the people who already have been historically most deprived and most denied access to their basic, right, health needs or otherwise, right? Economic, food, housing, et cetera, et cetera. So when that was noted, and the data was so overwhelming, and it was data that was translated into loss of lives that you couldn't ignore because the numbers kept going up and the actual strategies kept failing, right? They began to say, hold on, man, this is a huge issue. We need to be willing to have this conversation. So between the George Floyd uprising and, having the conversation about, why we have this situation where the most vulnerable amongst us are not getting what they need to get, and it's not just happening now, it's been happening, emerged, some argue about 260 plus. The numbers in APHA currently right now, they say is about 198 actual state and municipality cities declare racism as a public health crisis. Racism as a public health crisis. And what I want to just talk a little bit more is about those three words, right? Inside the sentence, racism, right? Why is that important for us to keep our actual pulse on? What is that really connected to? Beyond race, what is that really connected to? What is the behavior? What is the thing that makes that word so insightful, right? And then two, public health. What's the connection for public health? Why is that word strategic, right? For us as regular professionals, regular community members to hone in on, right? Is there some leverage, right, in articulating the language of public health? And then the word crisis, right? What really is a crisis, right? And in response to the crisis, have we felt we adequately responded to it? In lieu of everything, right? There's some things happened recently that could argue we haven't. Can argue if we did, we then went backwards. That's another person's opinion. That's anyone's debate they want to have. We want to look at crisis and what traditionally do we do when we say that we have a crisis? What is the traditional response? And then what has been the response? Then after we have that conversation, again, like I say, we'll move into dealing with one or more like real life examples, dealing with mass incarceration, and then we move forward. So in relation to racism, what I want to say first is that the ideal, so racism itself is an ideology, it's a mindset that actually governs and motivates a behavior. And I would say that the most scientific term that for me that articulates the word racism as an action or as a behavior is sociopathism. That's just the bottom line. People are afraid of the term, right? But if you think about what sociopathism is, it's the permission or the inability to regulate the fact that you begin to actually lack a concern or care for the actual safety and the well-being of people around you. You become disconnected. So racism, right, is an ism that gives you the permission to do so as a baseline, right? I don't like these people. For whatever reason, I don't like them. Maybe they're a threat to me. Maybe they've done something to me. Or maybe I just feel like I have a right to like people who look like me. Whatever the reason, right? I'm giving myself permission not to care for that other person or those other people in the same way that I would care for myself or people like me. That's the baseline of it, right? And that lack of caring cultivates, right, a form of sociopathism, right? Sociopathism, where you begin to morally turn off when it comes to being concerned about hurting or not hurting other people. It's very important to understand that. Beneath that, the motivation oftentimes for racism inside of our country is the science of supremacy. I have the right because I'm superior to, either by way of creation or by way of endeavors or by way of I won this confrontation. There was a war, there was a battle, there was a encounter, and if it wasn't me, it was going to be you. If I didn't conquer you, you was going to conquer me. At least I'm telling myself, right? Well, in this society, we know that racism and the way that it expresses itself today in modern times wasn't either you conquer me or I conquer you. It was that I choose to conquer you, right? And if I lose, then I lose. I have to accept the fact, and I'm going to go back to my part of the world and actually continue doing what I'm doing. But if I win, guess what? I actually get your land and I get control of you. And the reason why I have the right to do that, because I believe that I'm either genetically superior to you, or religiously I've been told that I'm superior to you, and it's my responsibility to help you, right? Even if that means to dominate you and control you. This is the narrative of our country. I'm not saying anything that anybody can't connect the dots to. So superiority is at the root, right, of racism, right? And the behavior, right, it translates from superiority into a form of sociopathism, where I begin to not have concern or care for the people that I believe, right, I'm better than, or the people I believe that I should have more access to the things of this world so that I can lead than them. Because I don't want to be led by them. They're going to be led by me, right? And if they can beat me and conquer me, then I'll accept that, because I have no other choice but to. But right now, I beat them and I conquer them. They're going to have to accept that. And this is just what it is, right? Because I'm better than them. Now, superiority and sociopathism as it relates to racism. I want to be clear. It's not racism in and of itself that's the problem. It's the notion that any human being thinks that they're superior to another human being, and therefore they can treat that person as less than. And in our field of work, we talk about preventing violence, because one of the things that produce violence is that in a moment or over a period of time, I begin to give myself permission to hurt another human being, either in a moment or over a period of time, or as an actual systematic belief. I give myself permission to hurt you. Well, there's many ways in which people do that. And we talk about what? Structural violence and interpersonal violence, right? And structural violence have many different faces. Racism is just one of the more predominant faces in our society. But you also have classism. That's a predominant face of structural violence inside of our society that produces the same type of sociopathism. Because you even have people of the same race, right, that treat people that of the same color as them, quote unquote, shade of color of them, as lesser than, because they believe because I have more, I'm superior to you. Sociopathism. And if I need to, I will hurt you to keep what I got, you know what I'm saying, and to keep myself where I'm at. And if I need to keep where you at, if it means taking what I have, I will hurt you. And I will consider you less than. We see that all the time with people that's houseless. We see that all the time with people that's living in poverty, no matter what color you are. People can take on that mentality. Then you also have sexism, right? Where people of a certain gender, males, right, you know what I'm saying, take advantage of circumstances and begin to impose their power and otherwise, you know what I'm saying, seek to dominate, right? Oftentimes, not all the time. That's because somehow they've been given this notion that they're a superior species or a superior aspect of the human species, right? And then you have minor cases where women, right, depending on the dynamics that they're in, they may find themselves attempting to do so. Again, the ism is not as strong because there's no system backing that. In the same way that if you have a white person that is actually supporting this ideal of superiority, right, there's a system backing it. But if you have a person of color doing it, even though it still may be a racist ideal that they have, it doesn't have the same type of impact because there's no system backing it. It doesn't mean the behavior doesn't exist, though, right? I'm one of those individuals that believe that people of color can be racist, right? But can they execute in this society the leverage of systemic racism? No, they can't. So again, you have sexism, right, as a structural violence. You have racism as a structural violence. You have classism as a structural violence, right? And these are some of the more just predominant. You also have, forms of actual religious, right, bias, right, as it relates to structural violence, ideology, right, based, structural violence, where religion, right, our political point of views, patriotism can be a form of actual superiority, right, that motivates sociopathism. So let's just be clear when we talk about racism, it's not just that issue that causes challenges in our society, but that's a major driver in the American narrative. And we all know that because of the justification of colonization, the justification of slavery, et cetera, et cetera. So that's racism, and it's systemic racism. Now, when you talk about public health is a method of being able to quantify the real impacts, right, of actual systemic racism, right? Public health talks about two very basic things, and we want to use layman language, right? We can use a scientific language. You want to use a layman language. The layman language is that public health is concerned about the actual quality of life and the longevity of human life. The quality of life, how well is a human being living? Do they have access to the necessary food, access to the quality air? Do they have access to transportation to get them to one place to the next place? Are they safe, right? Do they have access to knowledge in order to give them more skills, right? Quality of life, which determines and dictates longevity of life, how long you live. I don't care what you got going on, but if you have a population of people and they're living shorter lives, right? And it's connected to, right, in comparison to other people, you begin to see that they're living shorter lives in comparison to people who are living longer lives. And you begin to see that the comparison is that the people living longer lives are living a higher quality of life, and the people living shorter lives are living a lesser quality of life. Then that becomes a public health concern. And if you can attach patterns of behaviors that suggest that people of a certain ethnic or racial background, right, are able to leverage a certain quality of life because of the power and resources they have. And then there's a systemic behavior where those resources are not reaching other populations who happen to be of a different ethnic or racial background. And you begin to see that they're living less quality of life, which resulted into actual shorter lives. Then that becomes a public health concern, a public health issue. But it becomes a crisis, right, when you begin to see a significant disproportionate representation, to where you begin to see that, right, this is something that demands an immediate, right, emergency level response. And this is what our society declared was necessary back between 2019 and 2020. And I just want to read some language to you because I think it's going to be very important for us to kind of make sure that y'all not just thinking this from me. So one of the beautiful things about our conversation, right, is that we're not just talking about this theoretical type of reality. We live in a county that also declared racism as a public health crisis. Guess what? I'm gonna give you another one though. From the sea to the mountains, we're going to a location, right, that also declared racism as a public health crisis. Out of the 198 between the 260 something actual municipalities and counties and cities, we happen to be focused in our conference, right, which is also birthed out of a response to racism as a public health crisis, right? The Cape Fear Community Racial and Health Equity Summit, right? So we're in this kind of serendipity type of coincidental, I believe, divinely strategic type of situation where all this connects. But important, it's one thing for us to say what we say. It's one thing for the people, the community members of Buncombe County to say what they say. But let's hear what some of the actual public officials and the scholars, right, and the leaders, the executive leaders of the actual counties we represent said. We want to hear their voices. I'm not going to read the whole document, but I just want to read a little bit, specifically from the county, right, here in New Hanover. I believe it was in July of 2020, right? They declared racism as a public health crisis. All people supported it, I believe, except for one. It might have been two, but nonetheless, though, it got passed. I don't know the exact numbers of how many people actually supported, but it was definitely a majority, and that's why it got passed. It says the New Hanover County Board of Commissioners identified the reduction of racism or racial inequity as a critical priority and essential to effective and systemic delivery of health and human services in New Hanover County. Whereas the American Academy of Pediatrics states racism is socially transmitted disease passed down through generations, leading to inequities observed in our population today. Whereas racism unfairly disadvantages specific individuals and communities of colors, while unfairly giving advantages to others, individuals, and communities, and diminishes the strength of the whole society through the waste of human resources. New Hanover County's collective prosperity depends upon the equitable access to opportunity for every resident. And whereas racism has produced and perpetuates poverty through intentional and unintentional policies. I'm gonna say that again. Racism has produced and perpetuates poverty through intentional and unintentional policies that create barriers to economic mobility, and is a social system with multiple dimensions: individual racism that has internalized or interpersonal, and systemic racism that is institutional and or structural. Whereas racism causes persistent discrimination and disparate outcomes in many areas of life, including housing, education, employment, and criminal justice. An emerging body of research demonstrates that racism itself is a social determinant of health, and that social determinants of health and conditions in which an individual is born and in which he or she lives, works, learns, or recreates are key drivers to health inequities. For generations, communities of colors have faced vast disparities in job opportunities, income, and inherited family wealth. They are less likely to have housing security, access to health insurance, quality schools, healthy food, and green spaces, all of which can undermine the physical and mental well-being. Whereas, last one, it is well documented that racism itself has an adverse impact on health. Chronic disease caused by discrimination can trigger a cascade of adverse health outcomes, from high blood pressure, heart disease, diabetes, immunodeficiencies, and accelerated aging, all of which are high in representation within communities of color. Now, understand me. This is the elected officials. This is the chosen leaders. This is supported and actually reinforced by the academic, right, influence in our locales. This was declared boldly and loud in July of 2020, at a time when the whole world was paying attention to unraveling crisis of disease because of COVID, of uprising in our community because people being shot broad daylight and choked out broad daylight by the people they expected to serve them, right? This was what was declared as a way of saying, hey, we get it, we understand. This has been going on, it's still going on, and we have a concern, not just a concern, this is an immediate matter of emergency for us. That's to calibrate the subject matter.
That's from the county in July, and the city followed up in August with a Rise Together initiative where the city also came together and addressed racism or declared racism to be a public health crisis. And they went a little further than the county did with their declaration. And if I could read a few of those, I won't go through the whole thing. Whereas institutions and events like slavery, the 1898 Wilmington Massacre, racial segregation, and the Wilmington 10 prosecution specifically cast a long shadow in our city's history. And whereas the 1898 Wilmington Race Riots Commission's report's findings, which were published in May of 2006, observed that the racial violence of November 10th, 1898, precipitated an armed overthrow of the legitimately elected municipal government. And whereas the 1898 Wilmington Race Riot Commission's report found that the organizers of the overthrow took part in a documented conspiracy, the leaders, most of which are in control of our community today, our county today, that's not in this declaration, those are my words, but the leaders who were members of the Democratic white elite in Wilmington and New Hanover County achieved their political goals through violence and intimidation. And whereas the residual challenges stemming from episodes of such great magnitude as these are still felt today in ways that go both noticed and unnoticed by many in our community. And then they go on to, talk about how Wilmington has generations of work to do to be able to address the public health crisis that has come about from this historical context.
Mm-hmm. So thank you, Brandon, for adding, because that was actually a call to action. So they heard the response from the county and they followed up with a call to action. But what I want to focus on just real briefly as we transition into looking at an example, right, of like, because it's one thing to talk about all these theoretical things, but sometimes it's important to really calibrate and bring it down to earth and show the tangible, right, the people who's been impacted, and all of us have in one shape, form, or fashion. We want to give a space for one of our young and old leaders, right? You know what I'm saying? Young and old nowadays, right? We want to call them out, right? One that's been doing it for some years to be able to share some of their life experience, specifically around fatherhood and mass incarceration. But I want to focus on this fact that if you look at 2020 and you look at 2024 today, right, there's a lot of documents that's been produced. There was a lot of declarations and statements made, but there's also been a lot of ebb and flow, in many cases, complete flips on your head when it comes to action, right? When it comes to action, right, you can say that in some cases there was momentum around action on the community level, and then on the state and national level, and then it was a slowdown. And then that slowdown went from a slowdown to kind of like a shift, a transition, right? And then you go from the transition to, you begin to see that you had complete uprisings on the other spectrum, right? Kicking in doors of, federally, secured buildings, right? To express, right, an actual shift in consciousness, to express a shift in mindset when it comes to, and you could say back to return back to a certain mindset, right? Return back to a certain level of asserting this mindset of superiority, right? At least self-perceived, very important to state, self-perceived superiority,
Can
right?
I add something just to that call to action before we move on to
Absolutely.
Louis? Whatever, some of the things that the city came to, resolve as a part of that call to action. I do want to go through those. I don't want to leave without touching on those. Just because as members of the community, I want to, get a gauge of, if we've, felt this since 2020. We've seen 4 years now of, the city and the county having the opportunity to respond to this action. And the actions, I'll go down the list. The mayor and the city council seek to nurture a better understanding of the ongoing challenges of equity, diversity, and civic inclusion, the city's progress in responding to these challenges, and to facilitate an actionable plan for our ongoing response to these challenges. And to accomplish this, the city and staff are directed to develop a report that addresses the following: the city's efforts to address the challenges related to equity, diversity, and civic inclusion, including policy changes, investments, community partnerships, and community engagement. Identify the challenges not currently being addressed, including areas where disparity in conditions exists and opportunities for growth and improvement in our response efforts. Identify community stakeholders that have a primary or secondary role in addressing situations where disparity in conditions exists, and identify opportunities to increase awareness and understanding of these challenges, especially in the context of service delivery, and develop options, recommendations, identify resources required to accomplish measurable improvements to challenges related to equity, diversity, and civic inclusion for citizens regardless of race and ethnicity, gender, socioeconomic status, physical ability, or other relevant factors for the council's consideration. And last one, that the mayor and city council resolve to respond this report and its options and recommendations with necessary and prudent actions to continue our city's important work of responding to deep-seated challenges of equity, diversity, and civic inclusion, and to rise together as we work together as neighbors to ensure that all those who call Wilmington home have equitable opportunities for prosperity, participation, and quality of life. And this was adopted in the 2020 meeting, and I have not seen any follow-up.
There's been a little bit of talk, but not much action. Actually, there's been a reverse of behavior. And whether the city directly has been responsible for it, there's some examples we can point out with the city itself. But in general, the overall culture inside of the Cape Fear region, specifically inside of Wilmington, North Carolina, New Hanover County, has been a complete reversal of that particular declaration of action. You've seen action go in a different direction, the same way you've seen it across the state of North Carolina, where in some spaces the word racism or the word racial equity is not even allowed to be said and be able to be contracted out through federal funding because of the reversal of affirmative action that really birthed out of UNC, right? Because of some actual concerns about overrepresentation of certain populations benefiting or not benefiting from affirmative action. And we can go on and on and on about the things that hasn't been done. We all know what that issue is. What I want to say is that, you know, what's adequate for a crisis, we all know, and no one can claim has been represented. If you use the crisis, maybe if they said issue, maybe they said concern, right? Maybe they said, just racism and public health, right? But when you put the word crisis on there, you begin to look at what's happening around the world. We're bringing this up because we don't want us in this time in our history to lose that moment. That moment is only 3 or 4 years ago. It's not 10, 20. It's not 40 years, not the 60s, ladies and gentlemen, right? That's the reason why we're bringing it back up. That's the reason why we're quoting these leaders, why we're quoting the science, because it's only 4 years, right, since that was stated. Now, they didn't state anything that we didn't know, but they stated it, and they stated it in actual bold form. And we have to kind of keep that statement alive. We have to keep that science alive. We have to keep that inside the forefront, which is one of the reasons why, right, we hosted and we maintain these particular conferences. And periodically, we bring back what it is that we're actually trying to achieve with these conferences, which is the reason why we don't let go and don't let off on addressing structural violence, as well as, interpersonal violence. And people say all the time, Abdullah, that hinders you guys sometimes from funding. And, are you sure you want to? Yeah, because at the end of the day, man, if I ignore it right now, my children have to deal with it. They don't like to hear that, right? But if I ignore it right now, my children have to deal with it. And over time, I have faith and I have hope in our society that if we remain persistent, we still would get momentum. We would still get opportunities like in Bunker, where they funded the actual CPRV model for $2.5 million, addressing structural and interpersonal violence. Like here in Wilmington, right? Things are going to open up for us here as well. But again, we want to put the connection around crisis, right? And I'm thinking, Brandon, maybe it'd be good to kind of bring the brother Lewis in and talk a little bit. We're people of experience is just as a value as a form of knowledge as a textbook and the academic or any other form of scholarly information that can be transmitted, right, between people by virtue of actual science and models and frameworks, right? We believe that the experience of a human being is just as valuable, and actually offering the experience brings context. So when you take racism at the high level, systems and society and the history and all this other stuff, and you bring it down to one example, it can be an example of a narrative connected to substance use disorder. It can be child and maternal health, right? It can be anything. But tonight we chose, for many reasons, right, to focus in on mass incarceration. And you understand why after Lewis spends, but 10 minutes or so, 15 minutes kind of explaining something about his narrative, what he's seeing, where he's come from, and what he's done, and what he's doing now. And then me and Brandon will come back up, wrap it, and we're going to open the space up for everybody to be able to share their thoughts as we begin to explore what can continue to be done and what's being done and what can be done.
All right. Good afternoon, everybody. Thank you for letting me share my little piece here. Like you, Abdullah said, what I'm going to speak on is for mass incarceration, incarcerated fathers. There are a lot of parenting programs in prison, and fortunately, a lot of them focus on the mothers in prison, and things of that nature. And in North Carolina, in my own experience, I have served time in North Carolina from 1992 to 2018. And there were not really a lot of father-based programs where a man could, spend time with his children. And some of the women in prison I heard where, based on the security level that you were in, that the children come and spend time with the parents. Everybody emphasized the importance of the fathers in the lives of children. And one of the things I'm gonna emphasize on is the social policies and effects on incarcerated fathers. But before I get into that, I want to give a little background. Like I said, I was incarcerated from 1990 in North Carolina from 1992 to 2018. And during that time, I have a daughter. She was able to come see me. We was able to spend time and talk. There was a lot of brothers in there. I know that seeing the things that was going on in there, and they wanted to come out. They wanted to make changes. And it inspired me to come out and want to do the work that I'm doing now. One of the things that Abdullah was talking about, he was saying, well, if I don't do the work now, it's going to affect my children. When the fathers are taken away out of the whole platform, they won't be able to represent on a platform like this. They won't be able to speak. They won't be able to talk. This is a real big issue. But right now, I'm going to go into this fact sheet. It says facts provide key facts on parents in prison and policies that impede their ability to care for their children when released from prison. In 2016, 40% of people in state prisons and 50% of in federal prisons were parents of minor children. Most parents in prisons are fathers. 626,800 fathers compared to 57,700 mothers. The number of fathers in prisons increased 48%, and the number of mothers in prison increased 96% between 1991 and 2016. The social policies and effects on incarcerated fathers, they said there's several social policies. One of them that is about the child support, because at one point in time there was saying that incarceration was a form of voluntary unemployment for a father. So basically what they're describing as voluntary unemployment is what it can be considered as, say, for example, the pursuit of other interests. If you're not trying to pay child support because you want to travel, you want to, you're saying, I'm not eligible to pay child support because of education purposes. These are sort of some of the reasons that they fell under voluntary unemployment. The balance of work and family life, finding better jobs. So I say I can't find a job that will support me. I'm not making a living wage. Things of this nature. So the way they had, well, they're no longer doing this, but the way they had child support falls under voluntary child support, because they said the individuals in prison are falling under a category where they still probably be able to pay child support, even regardless of the time that they've been incarcerated. So they did away with that policy, but they still got policies where if an individual incarcerated, the child support is still ongoing. So when an individual gets out and he has child support in arrears, he would have to say, me, I really want to get out and I really want to support my child. I really want to be in my child's life. A lot of times, just not paying child support affects the relationship between the both parents, the mother and the child. So she doesn't really want him, just like I've dealt with this before. I don't want you around my child if you're not doing nothing for my child. So it becomes an issue between the mother and the father. A lot of the things I have read up on are not really directly dealing with the relationship between the parents. It's dealing with the relationship, say, for example, directly with the father and the child. The child needs to spend more time with the father after being released. Most and 99% of the cases in North Carolina now, especially now, when individuals released, they're released on post release, meaning that you're still serving a part of your time when you're released. Your post release can be in between 90 days and 9 months. There are conditions. A lot of people that's getting out on post release are having house arrest, having an ankle bracelet, having a curfew, having strict regulations set on them that you just can't get out and do. Say, for example, my daughter's mother was like, you need to spend more time with your child. I can't. Once I do find a job, if I'm allowed to work, I got to only work a certain hours. So if I find a job, McDonald's want to hire me third shift as a manager, I can't work that job because I can't work those hours. In some cases, based on, the crime that you committed and what, sometimes it varies what county you in, your relationship, or dealing with the individuals in that county. So a lot of conditions will hold you back from even working. A lot of conditions will hold you back from being around your child if your child is in subsidized housing. You only could be over there at certain times. You can't be over there when you want to. You can't go over there when you want to. And I know some cases they don't allow people with certain felonies to even be in housing and paid housing, where government is supporting the housing. If you was a known drug dealer in that area right there, they don't want you back over there, even though your child's mother over there, or say, for example, your child is there, period. Your grandmother taking care of, somebody else taking care of, they don't want you there. There's so many things that's holding you back that's not being considered. Transportation is another big issue. In North Carolina, you can be transferred anywhere in the state. What they claim they try to do is get you close to home. If I live in New Hanover County and I get locked up and I'm processed in Wake County, once I make a certain custody level, they'll try to get me closer to New Hanover County. So especially if you're married or have children, to get you there, but that's not always the case. If I'm in close custody, there are no close custody facilities in that area, I'm not going to be able to be there. So what I'm looking at is a lot of things that will impede the person, the father from spending time with his child, getting out and supporting himself and or his child, the relationship that he has with his significant other, the child's parent or whatever, if they're still in a relationship where they even communicate with each other. So when I got out, when I got out of prison, I definitely wanted to address a lot of these issues. And then the more I worked with individuals in the community, I see more and more issues that I wanted to address. I started an organization called the Rights Initiative to address mass incarceration, to address post-release conditions, the things that lead to the incarceration itself, the relationships that we have with our community and how we can get out and strengthen those relationships, how we can get out and start supporting the communities that the individuals that were ex-felons, how we can get back out and support the communities that we were actually harming. This is one of the main things. Establish a relationship with our family, starting with our children. And starting with, the ones that we're closest to, making amends to our family and to our communities. And this is a big start right here, just showing that we can have a good relationship with our family members and close family members, our children, things like that. If anybody got any questions, anything, there's a lot of other things I want to bring up that I see, and because I want to do more research on this, because I'm touched by this personally, because right now, because of my time away from my daughter, we don't even have a relationship. I'm doing this work to find a way that I can reestablish a relationship with my daughter now that she's grown, and because I didn't even know how to communicate with my daughter when I got out. So now that I'm moving forward, I need to establish that kind of relationship with my daughter.
That's excellent,
Thank you so
brother.
much for sharing, Brother Lewis. That's very vulnerable of you to, be able to go into that and talk about how, it has impacted you on such a deep level and, like a familiar level. So thank you for sharing on that. Does anybody have any questions for Lewis before we
You can
Brandon,
also
can you hear me?
Yes.
Okay, thank you. Brother Lewis, I wanted to thank you for that because it's so important that we heal ourselves internally, and part of that healing is with our families. So I just wanted to thank you for that, Brother Lewis. I think it was really important, and it's one of the root cause drivers for why we have trauma and violence in our communities and this type of socialism that's going on. So thank you for sharing that.
Absolutely, Sister Ramon. Absolutely. It definitely takes a lot for you to share that. But Lewis, you can go ahead.
Wendy has.
Sister Wendy, yes.
I just wanted to thank you for sharing that. That's kind of a situation really close to my heart. My son went through the same things with his child and his baby mama also. And to be able to say that is amazing. And it makes me be happy to know not a small amount of people, but more and more people are recognizing the trauma and stuff that is being felt from people with mass incarceration, families and their children's. So thank you.
This is actually a really great segue. Like, we're coming together now. Like, Brother Lewis has talked about how mass incarceration has impacted him through things being placed in, a strange city, being able to trying to figure out the travel, how it has, torn apart his family and his ability to, to kind of, you know, socialize with his daughter and create a relationship. Can we all just come together and brainstorm some other connections to mass incarceration and systemic racism?
Yes. If you're not traveling and you have the ability to just come off mute, we're gonna do some popcorning. And every once in a while somebody may say something, so Brandon may stop him, I may stop him, we may make elaboration or ask you to elaborate. But we want to make the connection. We want to make sure that what we're talking about is making sense and is sinking, as Brandon just mentioned, right? So we talked about systemic racism high level, right? We broke down the public health concern, right? We read what the leaders have said about the health and well-being, diabetes and chronic disease and mental health and substance use disorder. Then we went into the whole reality. This is a crisis and how we had a response. Then we brought it back home and got like to the heart, the real life example. But that real life example is like for an individual. Well, how does that relate to what we're talking about in terms of systemic racism? Let's make some connections, brainstorms. Anybody? What is a larger connection to systemic racism and mass incarceration, and what our brother Lewis just mentioned related to access to his children and the conditioning, where you don't have those skill sets, and when you come home, you're also inhibited from even learning and/or taking advantage of the opportunity because of the demands.
It was something else I wanted to add to that right quick. I was put in a unique situation here, coming into New Hanover County, and my desire to want to be involved brought me to Scotto House, brought me, being around people that was like-minded, brought me, they emphasized that I should get to know Vance Williams and the work that was going on at Scotto House. And the unique situation that put me in, I was able to meet Robbie, Vance, Kevin, Abdullah, who are all fathers. You know what I'm saying? I was able to see an example of what it was, especially like, say, for example, Abdullah and Vance. When I first met both of them, their children were young. Seeing how they're, and we've known each other years now, and I'm seeing how they are raising their young children, actually, especially women, their young ladies, because I have a daughter. So a lot of what I'm seeing is what I missed, actually. And a lot of times we don't have no examples of fatherhood in prison, no practical examples. We can have individuals in prison telling us certain things we would like to hear, but actually seeing it. And then the other unique point of that is me getting the chance to be, say, for example, during the sessions and trainings with Abdullah as a community health worker, like, yo, you're going through trauma while you're in there. And my daughter's mother not recognizing that, my family not recognizing that, my mother not recognizing that, and me not able to elaborate on that and say, well, I just came out of, just like Abdullah like to say, this is like the most violent place in regulated society. You know what I'm saying?
Rather than the most traumatizing.
And most traumatizing. And we don't articulate that to our loved ones when we get out. They feel like, well, you're out now. That's in the past. Move forward.
Yeah,
One
do
of the
better.
things One of the things my daughter said to me, it still boggles me. She said, get a life. I'm still trying to figure out what that's supposed to mean. But I was like, you know what I'm saying? I mean, because she like, all right, a lot of people like, you could set everything down in your past and just go ahead and move forward. It's not that simple. It's not even close to being that simple. Because a lot of us, once we're out, now we got to face a lot of things we were trying to avoid in the past. And we got to pay bills. And because everybody is, most of us are familiar with the fear of failure being the same thing as the fear of success. You know what I'm saying? So we got to face those things now. If we really want to be successful in a job, but some of us get out, get a good job, end up losing it because that fear of success, that fear of failure. But anyhow, yeah, I just wanted to add that little piece right there.
No, that's really important though. And add to the brainstorm. Thank you. Could I add to the brainstorm what he added to what we asked for you guys, right? And now he's also talking about the trauma, not only the trauma that he's experienced, but also the trauma that this families happen to actually grapple with, right? And they don't understand. But what he didn't mention, because we got blessed to get a good one out of Lewis, he came home and he minimized, right, the recommitting of crimes, right? So some people, when they actually come home and they have to grapple with all those obstacles, what do? They go back to what they know. They usually look like somebody being hurt, not just themselves, right? And if they don't get caught and are back in jail, then they persist with those behaviors in our communities, and they transmit that behavior to who? To the children, to the women, to their other peers. But we can say that and we say, well, that's just people committing crimes and they need to just do better. Nah. Why is it so many people incarcerated in the United States of America? Somebody tell me. I'm going to go ahead and just quiz you guys out here. We're going to have a conversation. That's how we're going to do a brainstorm. Why is there so many people incarcerated in the United States of America? Give me a couple reasons. Anybody?
Drug war.
Because it's incentivized.
Okay, hold on. Yeah, what'd you say, Kevin?
War on drugs.
Oh, there we go. War on drugs. And he said it's incentivized. Explain to the war on drugs we're going to come back to, because that's a hot one. That's the man that's been trained. He's been informed. But explain to me incentivized. Give me a little bit more to that, brother Brandon.
States have contracts with private prisons where they have to fill their beds in order to get the contracts from the state, which is funded by the federal government. So, or sometimes maybe not. In order to get these state funds, in order to get these funds, they have to have those beds filled
Yes.
with
Yes.
people.
Yes.
So
And telephone companies,
yeah.
right? Water companies, all these different other entities that went out of benefit, in addition from the federal contracts, right?
And the labor that they get from
Exactly.
the individuals that are incarcerated.
So you have those two pieces, and it's kind of a tricky piece, because economic incentive, you can say, was at the root of why prisons emerged as an actual overwhelming phenomenon in our society. But you can't say that was the sustaining reason that you had numbers, because post-slavery, which we're going to talk about at some point before we leave this space, right? There was chain gangs, and there was other ways in which they sought to maintain slave labor through the actual quote unquote penal institutions, right? Yet those numbers never really reached an extraordinary high level into a period of time in which our brother Kevin highlighted was in the 1980s and the 1990s. And he highlighted one aspect, or what I think is important to note, which is the war on drugs. Let's explore that. Because if I can just give the information, in the second war on drugs, the first war on drugs was a different type of war on drugs. It was really focused on psychedelics and actual marijuana. There was some attacking of heroin, but that was a mafia type, high level, type of drug industry. Nobody was really being hit for that. The people that was being targeted was a street level marijuana, and it was mostly psychedelic drugs. They was using it as a way to kind of like break up, what they refer to be revolutionary, organizations that they begin to define as criminal organizations because of drugs. That was 1970s, right? I believe under the Carter administration. That's the first war on drugs. The second one, though, had a unique type of dynamic. And by the time the second war on drugs began, before it, maybe 2-3 years before it, we was only sitting at about 275,000 people in prison across the United States of America. Understand that, 275,000 people in prison. That's probably what's inside of one state right now, right? People in prison, right? 207. Something happened, and it's important because this is recorded. We're going to share this with people. We want to make the connection from the simple incident that Lewis just gave us of one human being, and that's just his example, where Lewis wasn't a habitual criminal in the sense that he was murdering and killing and robbing and being a gangster and a rapist. He was, he had a whole story connected to drugs and just finding himself in the system, and he came home and actually was able to transition with minimum harm upon other people, right? So that's a low-level example, right? But someone who spent close to 20 years, Lou?
Yeah.
20 years, right? On and off inside that particular environment, and wrestled with what he wrestled with. People having far more superior examples. So what happened in the early 1980s that then led to this extraordinary amount of people being incarcerated in American prisons? We're not going to go into detail. Just give me some examples of some things.
What I wanted to say on that was we saw what other people were doing, even though the economic conditions were terrible. And this is one of the main things I used to hear a lot was, if I'm gonna make enough money to get out of the hood. Nobody got out of the hood. Everybody stayed in the hood and got hood fabulous, and it didn't change no real conditions. But everybody, then the young ones saw people in the hood making money, this, that, and the third, so they wanted to follow that same example.
So who are the young ones? You're talking about who? What population of people?
Young minorities, Black, Hispanic.
Okay. So we're saying, so now connecting to the war on drugs piece, African minority, African American, of course, Hispanics or whatnot, found themselves wanting to participate in the sale of drugs because of the glamour connected to it and the opportunity to get out of poverty, correct? That's what you're saying?
Right, yes.
Okay, good. So let's continue, because there's something else connected to how it went from 275,000 right, all the way to whatever number it is now, we have to be able to understand, because if you're talking about since slavery up until then, the number only reached 275,000. You can argue that prisons in and of themselves wasn't that much of a crisis for us.
I go a level deeper. I'll let Ramona go.
No, okay, go ahead.
Well, Brandon is probably more correct than I would be, but I was going to say they planted drugs. I don't know. There was something going on with the government.
You got to give us context if you're going to say planted, because that sounds like a conspiracy theory. So give us something concrete. If somebody want to help or do so.
I say when America transitioned,
they put the drugs in the neighborhood.
Okay, that's okay. And everybody here is going to nod their head, but you know me, right? I'm going to say, give me something concrete.
I mean, concretely, there's the Iran-Contra whenever, but going before that.
Now we're talking.
I think it's when America shifted into like being a war economy after World War II and being able to pick winners and losers in its society, who they wanted to be the slave labor force to be able to make and fund their war machine.
Okay, but I would say that I would challenge this, right? Because you said something, Iran-Contra scandal, right? The Iran-Contra scandal, go ahead. Cause we got our fact checker over here. It's very important.
No, you
give us some misinformation, disinformation, Kevin. Give it to us, man.
No, so all I'm going to add is just that, yeah, so out of fear of communism, the United States government basically allowed cocaine traffic from South America into the country, mostly through, I guess, originally through California, right?
Well, California, also Florida, but the main location was California because of an individual who happened to be there that already had an actual drug network related to actual marijuana that he was able to actually exploit, because he wasn't a Crip and he wasn't a Blood. He was neutral. He was a drug dealer, Ricky Ross, right? Freeway Ricky. And it just so happened that because he was able to move it so quickly, California became the place where he began to actually drive it. Now, the reason why that's important, right, is that even if you say they planted the drug, even if you say that they allowed the cocaine in, right, we have to make sure, because these are not statements that's not factual. We want to use language, right, that actually corners a person. I think, and everything everybody said is legitimate, but I think, not Kevin, but Brandon started to go in there when he said Iran-Contra scandal. But then now you have this thing that even gets more deeper. Because of the Cold War politics, where communism was, I have the potential of reaching all of Central and South America by way of Nicaragua, it was deemed a national security threat to actually help the actual Contras, right, the Sandinistas, right, actually lose control to the
Sandinistas.
Now you have the people there with the Contras they were supporting was, it's not the I don't know why I'm losing the language. It's Somoza family, the Somozas, right? The Somoza family was a family that was in charge and was actually allies to the United States of America. The Sandinistas were the communist organization that came in and established a successful revolution for communism, right? So they needed the Somoza family to be able to overthrow the Sandinistas. So they actually began to fund them. And then when it became internationally unpopular because they was being deemed as actual terrorists, they had to stop funding them, and then they had to continue to find a way to get money to them. They allowed the drugs and the guns to be sold.
The illicit drug use through the CIA. The illicit drug sale of the drugs through the CIA.
Absolutely, right? Well, the CIA allowed it. They allowed the generals and the various, high officials within the actual Somoza family to sell it. Right, it was the people from Nicaragua selling it, but the CIA was allowing for it and actually restricting federal government, other agencies, the DEA, from actually holding them accountable. This was all throughout Florida, but mostly inside of California because of the network that Ricky Ross set up. Now, this is important to understand.
And hold on, and according to reporting from Webb,
the Kerry report,
that the CIA was actually hands-on facilitating the sale of crack and cocaine into South Central Los Angeles itself. So they weren't just allowing it, they were hands-on facilitating and connecting, establishing relationships, networks, and trade routes.
Yeah, so the connection they had to that piece is that the Somoza families were actually identified as CIA agents. right? So that's how you got the connection that they was officially doing it. Some of them was actually working both sides. But let's get to I want to go further, not too much into that. I want to just kind of name that fact. So at the same time that those drugs were being allowed to come in and the actual guns were being allowed to come in, something else emerged inside the United States of America inner city communities. What emerged?
Crack.
Crack, but what followed up with crack?
Guns.
And how was the crack and the guns being used? Who was it getting to?
To the youth, the kids.
Youth, but also adults, right? Gangs emerged in the United States. 1980s is when you began to see a national phenomenon of Crips and Bloods spread across the United States of America. It was in 1980s that the actual blood, the movie Colors came out. 1980s had Ice-T, right? 1980s had NWA, right? You know what I'm saying? Like 1990s had Snoop Dogg and, you know what I'm saying, the Banging on Wax. And, you had this phenomenon of gang culture, right? Began to become something that became dominant in the communities. And what gang cultures, what came along with gang culture? What made gang culture so popular?
Its connection to entertainment and influence.
Before the connection to entertainment and influence, they were sitting on loot. They had money.
They had money.
Kids that was 13, 14 years old was making more money than some people actually made inside of an actual 2 generations in their actual families. You had cats running around with, you know what I'm saying, for 6'4" Impalas and whatnot on Dayton's and running around with fresh clothes, 14, 13 years old, right? Not to mention the older ones that was actually making that loop. So now you had, in the midst of poverty, you had this phenomenon of actual wealth began to actually flourish within these inner city communities by way of criminal activity. At the same time that began to happen in the mid-1980s is when also Ronald Reagan decided to declare the war on drugs. And within the 1980s, before they left the 1980s, going to the 1990s, the prison populations began to grow up to well into 1 million. California prisons alone went from having 3 or 4 main prisons that by time 1995, 97, they had 10 prisons in California. New prisons, right? And the numbers went from 1 million to, by the end of 1990s, going to the 2000s, you're talking about at 2 million. And then since then, it's been fluctuating between 2 million to 2.8 million. And the reality is that up until the actual early, like 2010 and after, it's always been majority African Americans, second majority Latinos, and now Latinos and African Americans are almost side by side. Majority minority inner city individuals. So when you start talking about the experience that actual Lewis mentioned, and you start talking about that, if you understand that prison itself is the only remnants of the actual legalization of dehumanizing human beings in our country called slavery. Now we're going to take it all the way back, because you say, well, that was a coincidence that actual, they did what they did with the prisons, and now prisons happen to be majority African American. We say, well, Abdullah, they was trying to stop communism, and there's a whole politics to that, right? But, because the only people who was really going to war was people of color and the lands of people of color, right? Russia and America never really fought each other. They fought each other in other people's lands or had other people fighting each other. But that's a whole nother conversation. You could say, well, Abdullah, you still got to realize it might have been just a coincidence that the money came, that the actual drugs came because they need to stop the war. Then they started selling the drugs, and Ricky Ross was good at it. And before you know it, became the spread. Like, yeah, you're absolutely right. But when you begin to understand, right, what gave them permission to use that population of people as collateral damage, then you begin to understand this notion of actual racism and this ideal of sociopathism. Right? Because they knew that they was actually incarcerating the same people that they was actually giving the drugs to. They knew that they was actually fueling that, even if it was for the purpose, right, of actually trying to stop a greater security threat. Then you begin to say, we want to talk about public health, we want to talk about racism, we want to talk about the real impacts of it, right? What gave them the permission to do that? What gave them the permission even today to make sure, when I say they, I'm talking about anyone that's prescribing to this ideal of superiority, to make sure that certain schools get access to resources where certain populations represented, but other schools don't. That certain roads get access to being rebuilt and being accessible. Certain parks get access to being rebuilt and being accessible, but other certain populations that's in other environments don't. What gave them the permission? Well, when slavery took place and they had an opportunity to end slavery, I define slavery as the actual systematic dehumanization of a population of people, according to the United States of America, when they first established the Constitution, the first article in the Constitution was the 3/5 clause that said that if you was not an actual American European, right, inside of America, Anglo-Saxon American, then you was only 3/5 of a human being. This was illegal in our society. The law is what's moral. This was a legalization of the dehumanization of people. So because he was only 3/5 of a human, the same system we had when we was up under the actual authority of the actual colonial powers of Britain, right? The same system we had that we can treat you as less than human. Now that we have this new world that we fought for, we still gonna treat you as less than human, but now we're gonna make it law. Because up under the British colonial powers, it wasn't a law. It was just a norm. But we as a society decided to declare it a law. And then later we fought to change that. Ladies and gentlemen, I want you to understand. They have a saying inside the Revolutionary War, whoever went to school and heard the thing, the shot that was heard around the world. You ever heard that saying?
Mhm.
I'm gonna write a book one day, or one of you guys gonna write a book. We're gonna talk about the one word that was heard around the world. Anybody, y'all been in my training, anybody can tell me what that one word is?
Except.
Except.
Hold up, I want to follow up on that because 4.5 people just voted to not remove that.
Before you go there, let me just close this thought. I'm gonna bring you back to that. I'm gonna let you close us out with that, right? So listen. So the accept, when they fought and murdered and killed each other and went to war with each other, which I thought was a noble thing, our society had a chance to eradicate any notion that we give ourselves permission to treat people as less than human. We had a chance to eradicate it completely. No exception to it, no matter what the reason is. But instead of eradicating and saying that indentured servitude and slavery in all forms shall be abolished. That's all we had to say, right? And that would have been an exception to the reality, not an exception, but that would have been an acceptance of the fact that we was wrong for saying that other people are not completely human and we got the right to treat them as less. But when we said accept, you begin to see instantaneously how even the prisons themselves began to serve as an exception of how you can treat people less than. You begin to see other type of behaviors like lynching and the actual, the post-Reconstruction era, 1898 massacre, et cetera, began to represent that exception to the rule of how I can treat you lesser than. And prisons was one of the legal ways that manifested itself. There's other ways that exception manifested itself, because once you give one exception to the rule, then there's always an opportunity to give other exceptions, whether legal or not legal. So in the 1980s, when that surfaces again, and you begin to see hordes of human beings being herded into an environment where it becomes the most violent and the most traumatizing, the most sexually repressive environment in our society. And we take generations, 2 or 3 generations of those young men out of the homes of their family, put them in those environments, and with little treatment, return them back to their communities, right, to grapple with the actual obstacles that Lewis just described. And you wonder why today we have a high level of mental health crisis, a high level of violence, right, gun violence, gang violence, drug violence. We have a high level of lack of actual capacity for our parents and for the adults to be able to regulate the next generation. It's been inherited and transmitted from one generation to the next generation. And it is a public health crisis, and this root of it has come from racism. And the root of that racism is that at some point we chose to give ourselves permission not to give a damn about certain populations of people. That's just one example. I'm gonna let Brandon, wrap us up with not wrap us, but make his comment, if he can. I know he had a really good point he wanted to make. And we have a few more minutes. We'll go ahead and give everybody a chance to maybe share some thoughts as we wrap, to see what direction we can go. I appreciate you guys.
Yeah, thank you, brother. I think we continue to give, and when I say we, like the collective public, we continue to give ourselves permission to treat people in this manner. Yesterday, after the election, or today, California had the opportunity to vote on Proposition 6 that would remove that exception to the rule for involuntary servitude and slavery inside of our prisons, and 4.5 million people voted against that, and that, you know, did what's left over of, you know what I'm saying, the spirit of that racism that still has is really kind of vested within us all.
Yeah, because it's not just white. It's not just a certain color of people that actually have imbued that particular mindset.
No, absolutely not. It's how we view people who are experiencing this in our society.
Yes,
And you know, whether or not they are throwaway, or, you know, and have the ability to, you know, live as, you know, citizens, and, you know, first class citizens in our world, not sub citizens.
absolutely. And this we want to do at this point. Thank you, Vanny, for that. You're excellent giving that point. Here's an actual example directly in California where they had a chance to focus in on that very specific issue, and they chose to actually not execute it. And I think Kevin and others, based on our conversation last night, would argue is because of a lack of actual thorough education, a lack of actual willingness and capacity, or even time and energy, to really examine these particular matters at their root and to look at the history and resurface the history, right? So one of the things, I want to share is that as we look at solutions over problems, right, and love over hate, right, and actual hope over disparity, understand that being involved in these type of gatherings, right, encouraging these type of conversations, right, being courageous about taking on that understanding and using very strategic language, right, and cultivating amongst our peers the necessity to use strategic language, right. You have to, no matter how many things that's out there that people can actually speculate about, you have to be as strategic as possible to talk about the things that's fact. There's enough facts out there to overwhelm, the lies. You want to focus on just the facts, because as soon as you're in a dialogue with people and you're trying to move and make things happen, as soon as you kind of venture off, you can have a whole, a catered meal in front of a person, right, that looks nice and is well prepared. And if they really at the heart of it don't want to eat that meal from you, they're going to find one reason, right, of something that you did with the cooking or the preparation to give themselves permission to reject your meal, right? And they're going to say, right, that I rejected it because of this one particular thing here. So facts are so important, right, to actually prioritize, right, as we begin to think about the world that we're in, because you want to inform people, and you want to inform people with the information that they can actually use, that they don't also further have to debate people about. Some things people are going to debate anyway, right? But if they can't produce something concrete, right, then all they're doing is speculating, debating. You can determine how much time you want to spend with them. But when people are sincere, right, about overcoming the crisis that we're in, right, you begin to give them information, they'll begin to shift. The biggest thing you have to help them understand, though, is this. If you give them the truth of what's going on, are you going to leave them disempowered and leave them left not knowing what to do, just afraid and concerned about the real magnitude of the affairs? Or are you going to offer them some solutions? And I believe one of the greatest solutions that we can offer human beings, right, is restored human connection, restored trust, right, and the ability to be able to find ways to work together, right, and to be able to build those numbers over time. And you don't have to be so loud about it all the time. Sometimes it's necessary to be loud, but sometimes it's necessary to actually build those networks and build those that particular cohesion quietly. So much so that if you build it up so much before anybody know that you built it, right, they don't know what to do with it, right? So I want to offer that as a potential thing. I want to say, man, like, what do some of the people in this room think is some things that we can possibly do, or we can be thinking about, right, to actually address, right, the nature of what our society has going on right now, right? There's some, actually, Romano probably going to jump in right here and talk about some policies that have been passed. We want to hear about those. If there's any initiatives, activities on the ground that's going on, things that you just do in your personal life, right? Even if what you do is self-medicate, take care of yourself with therapy or some form of spiritual practice. We want to open this space up to talk about what are things we can do in lieu of all that we just recently heard. And Brandon really brought it home really, really heavy for us when he actually mentioned that in a very specific state, the state that has more people incarcerated than almost any other place in the United States of America. And the United States of America has more people incarcerated than anybody in the world, right? And we already showed real life examples what that looked like, and a broad stroking example of what that has looked like inside of our country. And they had a chance to focus in on that very specific issue. And 4 point something million people said, nah, right? I chose the profit over actual what is fair. I chose profit over principle. Principally speaking, we should not be participating in this, but we know that that makes a lot of money in California. So they chose the profit over that. What other solutions do we have? Just a reminder you can share, then we open up the floor for others to be able to share. We're looking at
Okay, thank you.
solutions.
I understand. So I put in the press release. This is a lot of you know about this, and some of you were also co-authors from Dakota House. Abdullah was also a lead author on this, and we passed this as a solution, a comprehensive, one of the comprehensive solutions, right, to address racism as a public health crisis and violence as a public health issue, and that would be community health workers. And the reason behind that, because CHWs were birthed, right, due to racism and violence within our communities, and that goes way back to international history. You have, during slavery, it's been a history of CHWs doing that type of work. So we uplifted that policy. And, it's funny because you think that it hasn't really been used, because we have policy meetings. I'm one of the chairs of the policy APHA CHW section policy committee. And we found out that this policy is being used. People are using it to advocate on local levels, on state levels. We've actually used it in the state of North Carolina for some trainings that Chasm is doing. We took this policy to the Hill, the first Capitol Hill visit with NATRA and PIH, and we ended up using this policy. We had to do it really quick within a page and summarize it, and we were able to get appropriated $61 million from Deborah Ross's office to the region of North Carolina for CHW work. So this does work. And these staffers, when you go, I don't like going to the Hill. I don't like the energy there, but someone has to do it. And if you talk to these staffers, they don't know what's going on the ground. So if you have an opportunity to go to Hill Day and you want to be exposed to something like that with the National CHW, CH, and APHA and PIH, please get in touch and let Abdullah or someone know. But that's just an example. And then another thing is, if you look at the action steps, one of the things we've done is also implement a health equity assessment tool that Abdullah and I train on. And it goes basically from research to practice to policy to practice. And so uplifting this and getting your voices at the table when we create these policies, co-design these, implement these, train CHWs in the state around these action steps is being done. And we just need to make sure we can sustain it. I think that's the biggest piece, is how do we get to sustainability of these initiatives. Sorry, Abdullah.
Thank you, Romana. Anybody else? What else? What can we do? What are we doing, or what can we do? Right? Again, organization, mobilization, systems, policy, personal, right? This issue is not something that happens just on the systems level. Systemic racism and racism just doesn't happen on the systems level. It doesn't happen just within workplaces. It doesn't happen within just, our schools. It doesn't happen just within our police. It doesn't happen within our home. It happens in everyday part of life. So every solution is possible. Every solution is relevant. What else do we have? Anybody else? What can we do?
We can also form healing spaces. Healing spaces to me are just like, I'm listening to the brother Lewis, and I'm just reflecting about my life and some things that's going on with me in my journey, and there needs to be healing spaces where brothers and sisters can have this conversation and be solution based, of course, but also room for the conversation if they are confused, if they need help, or if they need those type of resources. Just having that availability and access to people and to their community, I think, is paramount, that we have healing spaces.
Thank you, thank you, brother Vance. We didn't have systems, policy. We didn't have healing, not just within individuals, but creating spaces of healing, which is powerful. What else? What else can be done?
Individuals that's coming out need to be more informed about what's going on in their community and how to deal with it, how to accept it, and be willing to accept it. Because it's going to vary on how it's delivered to the individuals. Because nobody want to come out of the system looking like, or having people believe that they was weak or ignorant while they was in the system. The individuals coming out like, yeah, I'm good, but they don't really know what's going on. Because the information is, even though now you got iPad, or you're not iPads, but you got more technology in there now before, because there was no pad, some little iPads and stuff like that they got in and out. That wasn't there. Only thing we went by what was on the radio or what was on the TV. So it's a little bit more flowing through that now, but at the same note, having these individuals that's coming out, being more informed.
Excellent. So now we got the policy level, passing policy, implementing policy, advocating, you know what I'm saying, to your representatives. We got the healing circles, and we got the training and preparing of individuals that may have been impacted by it. So not just people with mass incarceration, people that may be impacted by substance use disorder just because of the overall crisis and concern and not having access to resources. Anyone that's experienced hardship, providing services and helping them understand what they're going through so they not only can overcome it, but they can also begin to join forces to change it and make it better. What else we got? Come on, let's keep going.
I want to answer this question right quick that came up on the in the chat. It says why CHWs and community professionals are critical. Because of their relationship to the community. Because individuals is coming out of their system, speaking for myself, they're not going to want to listen to politicians. They want to listen to people that's in the community they can relate to. So just on that level.
Absolutely.
Right there.
Yeah. And CHWs also are unique voices within systems and within organizations. So they play a bi-directional role, a cultural translator. One of the 10 roles of the actual core actual consensus, project defined as CHW roles, right? We're cultural translators. Excellent, excellent. What's next? What's next?
I will say, to kind of piggyback off of that, I have been lucky because of my son's journey throughout the prison system. I have been able to build a relationship with some of the paralegals and the federal lawyers here in Asheville. And with that relationship, I have been asked to attend some of the meetings from people who is being charged with the lawyers just to interpret what that legal language looks like, because they're not breaking it down for the people they're representing. And on top of that, I've been asked to go to several conferences to be able to speak out, because what did it look like after my son was charged, served his term, and then got out? And then I'm still waiting on the actual date, but to be able to go in and advocate with the lawyers and the paralegals to see what the probation officers and parole officers, to get that communication between them, the lawyers, the paralegals, and the support systems, because your probation officers and your parole officers doesn't care about the support systems within the families, to make sure that these people are not reoffending, not going back in, things like that. So, building relationships like that and being able to advocate and show where the breakdown is. And, you can't put a Band-Aid on it. You actually got to fix it at the root. You got to
fix it. Excellent. So now we got, as a professional, building and expanding your networks, connecting with, people within systems and people within certain platforms to be able to help advocate to address some of the issues. Excellent, excellent. What else we got? What are things? What are we asking? What are things? Because the problem of systemic racism, particularly as a public health crisis, meaning it's something that's deteriorating the health and well-being, shortening the lives of human beings, specifically very specific populations of people, right? We're not talking about the whole society. I would argue it is a problem for the whole society. But in this particular case, they're talking about very specific populations of people, right? And it's deteriorating their health, and they're dying at earlier rates than everybody else. What are things that we can actually do? How can we not become so overwhelmed with the fact that we have all these problems? There's a crisis here and nobody's doing anything, and we're not in prison and enslaved by this reoccurring notion of hopelessness, right? Because if we don't have solutions, if you don't have ways to address it in minor or mid or big moves, right? Then you're going to find yourself in a state of being in despair. You're going to find yourself in a state of not knowing what to do. And then that's going to also then decrease and deteriorate your own well-being. Or even worse than your own well-being, you're going to be forced to become apathetic, which, if anybody that knows how we move, we understand that violence happens between the perpetrator and the one that's being perpetrated upon, and then the one that's actually paying attention, the one that's actually witnessing it. And it's the one who's witnessing it is the most dangerous, because there's more of them witnessing it than the ones that's participating in it, right? And if they don't care, then there'll be more people participating in it. No one's going to stop it. No one's going to actually, be able to make it unwelcome inside of our society. What else can be done? What else can be done? Anything else? Anybody else have something to share?
I think people.
Amina?
Go ahead.
Well, I would just add that, people who have just been coming out of incarceration that's continue to strive to be a better model, because your lived experience in in my situation, uh, because of my past experience of incarceration, I was able to help kids. I was able to help to be a model to show them
Mm-hmm.
that you can get through this. And I think in the last, it's that society has taken a slow look at the need of the value for people being incarcerated to use their lived
Mm-hmm.
experience in order to help some of these younger, specifically Black
Mm-hmm.
youth, because there's really no one else who can talk to them or have that kind of experience except a person of color that may have been incarcerated, that they're able to look to and listen to. So I think, people like ourselves that have been incarcerated in Lewis, we need to continue to be models for the youth, continue to talk
Yes.
to the youth and be in the community where they're most impacted, and where they can see that, and just not only see, but listen to as well, that there's other ways that you can do this, other ways that your
Absolutely.
lived experience can be used.
And I would add to
So it's not
that,
a total loss.
and I'll add to that, not only be role models for those who coming home, but also role models in any field, role models in any capacity, and realizing that you becoming more informed, you becoming more capable, you becoming more strategic,
Yes.
and being able to
Yes.
change the way that people are thinking, you become more strategic and being able to restore healthy relationships and be able to bridge gaps and bring people who are separated, bring them together, create more, cooperation, that those are models for other people who can also be inspired by. So yes, for prison, but yes, for everything else, whether you're in academia, whether you're a medical physician, whether work within the field of substance use disorder, working with youth programs, prisons, whether you work on playgrounds, wherever you at, church, masjids, it doesn't really matter. Wherever your place of gathering, even in your home, be aware that we can be examples for other people to actually help prepare them for what we're dealing with in life. Sister Amina, and then we'll go to Kevin. I think Amina unmuted earlier. Want to give her a second to see if she wants to share a thought. Okay, we'll go to Kevin, and then we'll come back to Amina if she's available to share.
Okay. Yeah, for people
Oh, there
like
she go,
me.
Kevin.
Oh,
There
go
she go,
ahead, go
Kevin.
ahead, go ahead.
Go ahead, Amina. We've seen you come off.
Oh, I'm so sorry. I was having trouble hitting the button. Yeah, thanks. I wanted to say two quick things. First of all, related to the last comment, just thank you so much. I think one of the things that, those of us who are oftentimes in a support role can do is listen and learn from people who have lived and living experience. And so this session today has been so important for me. So thank you to Lewis and everyone, Wendy, for sharing your stories. And enriching my understanding. And then also the other thing I was going to mention was related to the resolutions that you all read at the beginning and that we have in Buncombe County. We have this reparations process, and it is so important that it be successful because there's a lot of people looking at the reparations process in Buncombe County and Asheville City. And one of the things that I'm going to do, and I think I have been doing, is supporting that process and the people who are engaged in that process in any ways that we can, to make sure that, just like you were saying, Abdullah, that, the people are prioritized, that people's resource allocation is prioritized. So that's something else. It's policy, I know, but I think it's very, very, very intentional policy to confront racism as a public health crisis. Yeah, thanks.
That's excellent. I appreciate you sharing that. We have we're going up to actual Buncombe. I'm about to touch base with Will to see if we can actually get someone to share some more information on the reparations process and the update that actually is an action item, right? That's actually connected to the declaration that took place out there and others. So I appreciate you reminding us of that, Amina. That's really excellent. I forgot that they're doing that down there. And actually, I didn't really forget. I think I didn't prioritize mentioning that as an action. I was so concerned about the fact that so many people didn't do anything. But that is happening down there. We're getting ready to go head down there. So we're going to go get educated on what's going on with that. We'll touch base with people on Friday, I believe, and then try to see if we can get some of that integrated in what we're doing on Saturday. Thank you for that reminder.
Sure.
Amina.
Yeah.
Kevin, and we'll go to Salim and then Ramana, and then we'll give another round before we actually head out and get everybody back to their families tonight. Kevin?
Yeah. So she actually, Amina hit on a lot of what I was going to say already. So it's important for people like me to show up and get with community leaders, get with community organizations to learn and come with a sense of cultural humility so that we can be better informed when we're talking or advocating on behalf of populations.
Yes.
Absolutely. And we're going to put the principles of cultural humility out there for everybody, right? So to be, hold on. I'm sorry. Hold on. So to remain, who can help me out? So remain critical self-reflection, lifelong learning, right? Recognizing and challenging power dynamics too. And number 3, right? Shifting and changing, right? Policies and systems, right? To actually support the things that we recognize are not equitable and not fair. Very 3 key components, right? You have to remain aware of yourself, right? You have to remain aware, where am I at? How am I positioned in this fair, right? And then be willing to learn from others. That's the piece, right? Then once you learn, you have to position yourself to be poised to do what? To recognize and see what things are inequitable, to see what things are unfair, even within yourself, in your situation with somebody, and then be willing to challenge it and say, no, let's make this better. And it's not just a one-off thing, right? Or a one-off type of statement or a one-off type of action. You want to then look around and see, is there anything that I can do to support a shift, right? In cultural dynamics, right? A shift in the system and how things are operating in order to sustain whatever it is that is actually, not fair or not balanced. So I appreciate Kevin mentioning that word, cultural humility. But I just want to make sure people understand it doesn't look like us just saying to ourselves, hey, I'm willing to learn from other cultures. No, it's a very specific science, and it's one that we uplift as community health workers and coupled with popular education and the work that we do. Let's go ahead and go with Salim, and then we'll go with Ramana, and then we'll wrap up.
All right. I just want to touch on one of the things Robbie said, and I agree that we need to have examples of individuals like ourselves, but at the same note, somebody that look like us and somebody, that's doing some of the same things and going the direction we want to go in. But at the same note, being open-minded to learn and learn around and be around new people, places, and things. I want to touch on something Kevin said, and me and Kevin, and just for everybody to understand, me, Kevin, Abdullah, somebody else. I want to say Vance was in the room yesterday. We was just having a general conversation about fears. You know what I'm saying? And Kevin was speaking about him and his son going into it was inside a mountain,
A
like
cave.
crawling through a cave, yeah. And they was going through this hole. And we're talking about our fears, our claustrophobia, and this, that, and third. And, me and Abdul like, yeah, I'm not gonna put myself in that situation. But at the same note, Kevin was like, yeah, my son, when he went through, it was like he was sort of fearless with it. And one of the questions that came on my mind is like, if I was with my father at that young age, would I have the same phobias I have now? You know what I'm saying?
He sent the
Would I have
picture
been
too.
fearless also? Because if I could see my father doing it, Kevin was like, yeah, I had a little bit more weight on me. You know what I'm saying? It was more of a challenge for me. But his son being there with his father, seeing that, was like, hey, I can do this. You know what I'm saying? And sometimes for a young man, you want to impress his father anyhow. So you're not going to be like, yeah, I don't want to do this. So, and I believe that with something might have added to his son, wanting to be a part of this thing with his father. And like I said, it just had me thinking, would it have been different for me if I had somebody there as example to, to show me that it could be done. So
And fatherhood is powerful, and it's proven in every spectrum of any study that having a mother and a healthy father and healthy mother around are one. Even if you don't have the other one, just having one of them that's healthy. But if you have both of them that's healthy, right, it's powerful, man. Like, you know what I'm saying? So you resonate with that. Ramana, you're muted.
Sorry about that. I wanted to add a couple of things. So we found out during readiness, right, when we do implementation of a tool, that what's critical is you need to have a systems champion. You need to have an advocate within the systems. And I'm talking about organizational systems level. So whatever TBO is coming into, trying to work in a certain field with systems and organizations, they should have a strong partnership with somebody who's in the academic setting or the systems level, because that's going to push it really far. If you don't have that champion in the system, as many of you know, you're not going to get very far. The other piece is on the interpersonal level. So this is from my own lived experience. I think it is so important to revisit what Brother Salim said. The heart and the condition of the heart that each of us have, we may indirectly or directly not even know how we're contributing to what's going on, even though we're not, I don't consider myself a racist on any level. As a matter of fact, I'm actually kind of worried right now and nervous because the area I live in with my mom, there's literally someone telling another parent today that if he saw anything weird or different, he was going to hit that person with a hockey stick. I mean, they're visibly excited about it too. This is the kind of condition we're living in now, and she overheard it. So for me, it's like, okay, what do I do for myself as well to cope in this kind of society? And on an interpersonal level, that looks at the heart and taking care of ourselves and going to, therapy if we need it, addressing the trauma that we've experienced so we don't pass it down to our children. So we don't, subconsciously do the things that other populations are doing that we don't mean to do. And that can happen just by having bitterness or whatever it may be. And I'm not saying we're perfect beings in the society, but doing what we can do on those different levels, especially interpersonally, and then making sure if you're working on the systems level, you're working in the organization level, make sure you protect yourself. If you're a CHW and you don't have a degree within the system, because they will eat you alive, and make sure you have someone in the system that's going to advocate for you that you trust.
Absolutely. Thank you, Ramona. That's excellent. Excellent advice everyone gave. Brandon, we're getting ready to wrap it up. You have any final thoughts before we, kind of conclude and make an announcement about our activities moving forward?
I'd just like to say thank everybody for sharing their time, sharing their thoughts, being able to, come together and brainstorm. Today has been kind of heavy for a lot of people. So, thank you for, being in a space like this. I think, coming together and establishing relationships, being able to talk to one another is, a form of community. And this is a part of the healing process. So I'm thankful to have you all here. Thankful for everybody that shared their, vulnerabilities, things that they're going through in their life. I know that we've all been through some crazy stuff, and we're all on a journey. So just excited to be, to have y'all as a part of my community.
Excellent, Brandon. You did an excellent job hopping in and moderating and keeping the conversation going. Again, I echo what Brandon said. We want to express our gratitude to everyone. As y'all know, we'll be loading up and packing up inside the Barack, what I named one of my vehicles I have. And we have some gifts from our beautiful community here in the Cape Fear who took time to come and respond to requests for clothing, winter clothing for young people primarily, but all people inside of the Buncombe County area. So we're going to bring that down there with us. We got a little trailer. We're going to pack it up. We have volunteers coming through and sorting it out, so we're not having to add more work for the people down there in Buncombe. We've been in contact with our team down that way, our family, our professional family. They're excited for us to join them. We're going to have a pretty light day on Friday, but on Thursday, right around 5-ish, 6 o'clock, we'll go live for a hot little second and be silly. Show everybody that we kind of getting ready to actually migrate from the sea to the mountains, since that's been our theme. And the goal is this past summit is to focus on the building and sustaining of community-based ecosystems, right? And we're saying that these are the things that even in a time of crisis, right, everyone responds, right, to a natural disaster. We've seen it over and over again, right? Whether it be war, whether it be a storm, an earthquake, right? People just step up. That's what they do. But we've also found the people who are most equipped, right, to respond instantaneously, right, when things happen, are people who already have existing community networks, who already have existing community ecosystems, not the professional ecosystem. That happens. That's there. They're trained. They're being paid. They're being paid, right, to come in and boom, they got that set up. They're way more effective than anybody else, more hands down. But then even when you start talking about government and other organizations, many of those individuals are not working within those spaces because they're closed, right? So they really have to then tap into their friends and their churches and their Islamic centers and the various people in their neighborhoods. And if they have good relations within those groups, then they're effective, right? They begin to give what they have to offer, and they give the best of themselves, and they do a great job. But those professionals who are already serving communities, who are already connected to the most vulnerable populations, who already got an actual Rolodex of names and numbers and resources of people in their community, because that's what they have to do, right, all the time. Those individuals show up in a different type of way during a time of crisis, right? So they're showing up for the people in need during the time of crisis, or in their time of crisis, and then there's a universal time of crisis that happens, right? Like the recent flood that took place and the storm that took place inside of the mountain area. They also show up as well too. But then guess what? Like everybody else, they take that same network, they say those same relations, right? And they actually continue to work after the crisis has subsided, right? So the power of social ecosystems, specifically community-based ones, community assets, community leaders, community health workers, et cetera, right? Community-based organizations, and then their networks, the youth and the churches and et cetera, are so powerful. So we're focusing on the value of that in this particular summit, how to build that, how to develop that, and how to sustain that, and then how to leverage that and activate that to be able to respond to the things we have going on in our society. Our network, over 100 plus CHWs in North Carolina, specifically CHW VPPs. There's over like, I think 3,000 or 4,000 currently right now of community health workers in general, but we're CHW virus preventionally trained, right? We may have other credentials, right, within the larger CHW spectrum, peer support specialists, but there's a group of us that went through a 60-hour, engagement, relationship building, and kind of like a rites of passage into the field of virus prevention. It's about 100 of us, man. We're going to actually leave from where we at here. We're going to go down there, connect with them inside the mountain area where the majority of them actually reside between there and the Cape Fear. We're going to enjoy each other. We're going to build with each other. We're going to try to record as much as we can. We're going to try to share it with the people. We're hoping that everybody can benefit from it. We hope that everybody brings the same type of spirit that you guys brought tonight, a spirit of learning, a spirit of sharing, and a spirit of openness to figure out how to overcome the challenges we're dealing with in our society. You guys have a blessed night. Again, this is our actual second session of the Cape Fear Community-Based Racial and Health Equity Summit. It's the 4th annual, and we're focusing on building and sustaining social ecosystems. And we're going from the sea to the mountain. Have a blessed night. Thank you so much.